Started. This keeps going in and out, so I apologize. First of all, I want to ask everyone, if you are currently retired already, you should have one packet. Does every retiree have one packet? Nobody needs one? Okay. If you're actively working and thinking about retiring, you should have two packets. So if you're thinking about retirement and you only have one packet, let me know and I'll get you a current one. If you can raise your hands, please. Get one. And the difference is, if you're still actively working, then you're going to have a current packet as well as a retiree packet. And what that is you're going to have to pay your current premiums up until you retire. So we want you to have both packs, okay? I don't know why these, but... Oh. Okay, so we'll go ahead and get started. My name is Suzette Couples, and I'm the Senior Benefits Specialist, and I'm excited to be working with you all during this transition. It's going to be a big transition for us, but it's one we're going to make as easy as possible, as smooth as possible for all of us. I have a staff of 3 more benefits specialists. Tika Kennedy, she's here in the back. Lynn Madigan is right here. Shannon Perkins is over here. So I've been emailing out, so you all have my email address, you have my phone number. I will be setting up meetings with everyone via phone if you can't come in, or if we can come in or meet or do something during our open enrollment. I really want to meet face-to-face to help people with that. Our open enrollment will run from September 6th to October 31st, okay? Today you're going to get a lot of information. It's going to be a lot for you, so I know you're all going to have questions. We're going to rely on the state a lot because they're going to be able to look at, you know, how many years you were here versus if you were somewhere else. Your TCRS plays into that. So we're going to rely on these ladies for their assistance. So today we do have presentations from the state. We have a presentation from Blue Cross and one from Cigna. So you will get a lot of information. With that, I'm going to turn it over to Judy Carmen. She's with the state. And if you have any questions, we will have questions at the end. Thank y'all.
Thanks, Suzette. Hello, everyone. Again, good afternoon. My name is Judy Carmen. I am an education and outreach specialist with the state. I'm also here with my team over there. So if you guys want to wave hi, we have our communications officer, Ian, my administrator, Nikisha Miles, specialist, Ebony Davidson, our director, Jessica Southern, and specialist, Rachel Kraft. We're all going to be supporting our Suzette and team over here to make sure that everyone's taken care of and that you get the appropriate information that you need. I know this is going to be a big change for everyone, and we want to make sure you guys have all the information, all questions answered to the best of our abilities so we can make this a smooth transition. So this is going to be the topics that we're going to be covering today. If we don't address it during just this presentation or even the next presentations, you can come up and talk to us after our presentations today just to make sure that you get what you need answered. All right, so just to get a quick idea, who here is still actively working and looking to retire? Okay, so it looks like we have a mixed bag here of half-half, retirees and active employees. So this is going to impact more so active employees, and then we're going to look at the retirees that are already retired, because this is the eligibility to get retiree insurance if you're looking to retire. And I'm going to explain how this impacts the retirees that are not working anymore. So the first thing is going to be, you have to be a TCRS retiree, where you have to receive a pension from the Tennessee Consolidated Retirement System. I know Rutherford County Schools already participate, so that's not going to be an issue for a lot of you. But the kicker is that you must be receiving a monthly pension. You cannot do the lump sum. That will disqualify you. The second is going to be the hire date, where you have to start work prior to July 1st, 2015. If you have any local government service, if you work for Rutherford County local government, you cannot use that time to hit the July 1st, 2015 criteria. It has to be with the state, local education, higher education, start date of July 1st, 2015. And the local education time has to be with the agency that participates with state insurance. So that there's another category with that as well. Now, for new retirees, so this is after July 1st, 2023, you must fill out an application to continue insurance at retirement, and this is where we're going to review your work history, your time with TCRS, and just make sure that you are eligible and you're meeting all the criteria I'm going to go over today. And then, how many people here are going to be covering dependents as far as spouses or children? Okay, so I'm going to go more in depth with this later on, but you must submit dependent verification documents with the application so we can make sure they are your valid dependents. Now, our other criteria that you have to meet, the first one, from talking to everybody, it seems like it's a big surprise, I guess. The county requires you to have 20 years of service, but with the state, we only require 10 years to be eligible for retirement insurance. Now, state, higher education, local education with agencies that participate with state insurance, you can combine all of that to hit the 10 years. But again, local government service, you cannot combine it. We will not count it. It's only state, higher ed, and local ed towards your 10 years. So please be aware, if you're not sure, we have an awesome retirement group with the Benefits Administration Service Center. You can call them and they can review it and tell you where you're sitting at, because a lot of people have what we call mixed service, where you're working for Rutherford County local government and then you go to the school system, so you're kind of not sure where it stops and what started for each agency, so you can call them. Now, for both the current retirees and the new retirees, there's going to be deadlines. I believe Suzette and I talked where for the current retirees, we are looking at August 26th is the deadline to submit the paperwork to transition you onto the state retiree insurance. For the potential retirees after January 1st, 2023, when you apply for retiree insurance, you have 1 month to submit that application to continue insurance at retirement after your insurance ends. I do not recommend waiting for that 1 month. You can submit paperwork early, 3 to 4 months in advance. One disclosure is that there's going to be 2 applications when you retire for the new retirees. One is going to be through TCRS, which is for your pension. They are running 3 months behind as of today. So you want to make sure you start this process 3 to 4 months, so when you retire, you have income. Because if you're retired and it's still only 1 month in, you're going to be sitting there for 2 months with no income. So start early, apply for TCRS, and then apply with Benefits Administration for insurance. We're 2 separate entities, 2 separate applications, but get that ball rolling early. Don't wait until the 1 month, and then you have no insurance or no income. So always start early. And then for the date of retirement, we covered that, the July 1st, 2015. And then for ages, this is going to impact everybody, whether you're current or looking to retire. If you or your spouse, you have to be under 65 to qualify for the retiree insurance. If you're covering children, you can cover them until they turn 26. For retirees or spouses, when you turn 65, you lose coverage the first of your birth month, because that's when Medicare kicks in, is always the first of your birth month. Is anybody here born the first of the month? Okay, so this is for you. So when you turn 65, Medicare has a wonderful rule where you actually start the month prior to your birth month. So say your birthday is May 1st, your Medicare is going to kick in April 1st. So just kind of be mindful of that when the time comes. And for children, they get to keep coverage until the end of their birth month. So if John's birthday is May 15th, he'll have coverage until May 31st and then drop automatically. And we do send letters, so you know this is going to happen months in advance. It's not just a surprise that, surprise, he has no insurance when he's in the ER. So you will know this. And then for continuous insurance coverage, I'm going to go over as far as how this is going to impact active employees, because with current retirees, you're already retired, so you're good. But for potential retirees, if you have less than 20 years of service, you need at least 3 years of active insurance coverage leading up to retirement. So if you are going to retire May of 2023, and we just started as of January 1st, you've only been on the plan for 5 months, so there's no way you can hit that 3-year requirement. We will waive that 3 years just because there's no way you could have hit that. But just go forward, say it's like May of 2026, you've now had that opportunity to be on the plan for 3 years, so we will not waive it, we will hold you to that requirement. And this goes for the same for people with 20 or more years, where there's only 1 year requirement to be on the state insurance. So please be aware of that. If you're not sure, again, call the service center, tell them the date you're looking at, and they'll kind of work it out as far as when would be a good time. There's other factors involved as far as running out leave time, sick time, however you want to work it, so you kind of know what date to put. Now, date of retirement, this is where it's going to be important to figure out when you want to retire, if you want to just cash out sick time or just run it out, because you must retire before your active insurance ends. So using the same May date for next year. So if your insurance is going to end May 31st, when you apply for TCRS, you want to put that May 31st date or earlier. If your insurance runs out May 31st, but you put June 5th, it's going to disqualify you for TCRS. So when you apply for your pension, make sure you put the date before your insurance runs out. If you're not sure, always check with Suzette and team, and they can help you figure out when it's going to end, because there's options of how you want to retire and when you will stop getting paid based on how much leave and time you have accrued. So just please make sure of that. Now, for the 10 years, there's different criteria as well of what does not count towards the 10 years. So military time that does not interrupt service will not count. So we have a lot of people who had, say they were in the Army for 10 years, and then they got out, started working for the school system. So that did not interrupt employment, so you cannot count that towards your insurance 10 years. TCRS, which is a separate entity, may count it towards your pension payments, but we don't. They have different rules and regulations, and we have different rules and regulations for insurance. Now, for TCR service that you have cashed out, that will not count towards your 10 years. So an example of that is, say you worked for MTSU for 2 years, you quit, came to Rutherford County Schools, you cashed out everything you've put in at TCRS, and then you worked for Rutherford County for 8 years. Technically, that seems about 10 years of service, but because you cashed out that time at MTSU for the 2 years, those 2 years do not count, so you're still at 8 years. But again, if you're not sure, call the service center, and I'll give you their number at the end of the presentation, because they have access to everything, and they can document on your record and look at everything so you know you're getting the most accurate answer as far as eligibility years and what you're going to be looking at for premiums. And I mentioned this earlier as far as the local education agency service. So you have to work for an agency that participates with state insurance. There's some big counties like Shelby County, they participate with TCRS for pension, but they don't participate for state insurance. So if you work there for 5 years, came to Rutherford County, and that's another 5 years, TCRS will say, yes, that's 10 years for pension, but insurance-wise, that's only 5 years. So just be mindful of that as well. And of course, any local government time, we don't combine. Now, I know there was a lot for eligibility. Does anyone have any questions so far or need me to clarify? We're good? Okay. Now, this is for current retirees. In order to transition from your current county school insurance to the state retiree insurance, you must fill out this form. It's in the packet for retirees. It's right on top where it'll say retiree insurance change applications. It's 4 pages long. You will fill out just the first page. You don't need the other pages for now. But please make sure you're filling out all of your information in part 2. That's your HIPAA information, name, date of birth, social. And then the other parts, 3, 4, and 5, you're going to mark off what you're electing as far as medical insurance, what type of plan, dental, and then who you're covering, yourself, spouse, children. If you are covering for those that have dependents, please make sure you're putting your dependent information down in section 6 and then sign and date it. And again, the deadline is August 26th. Just please make sure you can keep in touch with Suzette and team so you're not missing that date so we can get you guys enrolled for January. And again, there's the name. Okay, so for potential retirees, after January 1st, 2023, this is the form that you're going to fill out that says the application to continue insurance at retirement. This is going to pretty much be the same as the current one now for current retirees, but the difference is on the bottom, your agency is going to certify that for us, and that way we can verify the years of service and just making sure you're eligible for insurance. So there's a slight difference as far as the 2 forms, but this one is for potential retirees after January 1st, 2023. And if you don't want any insurance like dental or vision, if you are not covering any dependents, you can leave those fields blank. You don't have to do anything with them. Now, who is certified teacher retirees? Just to kind of, because there's 2 different premium eligibility criteria. Okay, so for certified teachers, this is your premium table. Now, this is only the PPO example. So you can see it's broken down into 3 tiers for years of service. It's 30 plus is the cheapest, 20 to 29 years, and then less than 30. You'll see there's 2 plan categories as far as Blue Cross S and Cigna Local Plus, and then to the right of it is Blue Cross P and Cigna Open Access. The category to the left is a smaller network, and the category to the right is the larger network. That's why it's a little bit more expensive. I'll go into more detail of the differences in a little bit here. Now, for local ed support staff, this is your premium table. Technically, the state does not provide any premium discount based on your years of service for local ed support staff. However, you guys have an awesome county, and they are providing support for the premiums to reduce the cost. So you do see a reduction based on your years of service. But there's only 2 categories for local ed support staff. So it's less than 20, and then there's over 20 years of service. So that's the difference between the 2 that you are seeing. And the premium should be in your packet in the back, where it's broken down for dental, vision, certified teachers, and then local ed support staff based on the years of service. So I know this may be hard to see, but you can look at it in your packet. Now, this is important information that both current and potential retirees need to know. So the first one is the continuation of dependent-only health is allowed as long as the retiree, which is the employee that retired, is Medicare eligible. So say, for instance, you're retiring next year and you're 64, spouse is 62, children are 18. And then as of 2024, you turn 65, so you're coming off that plan, and your spouse is only 63, kids are 19. The state allows you to keep your dependents on the insurance until your spouse turns 65 and the kids turns 26. So we don't just kick you off. They're allowed to stay as long as you were already covering them. So I know a lot of people are worried what's going to happen because they're the retiree, but the state, we make sure you're taken care of as well. Yes, ma'am. Technically, yes. So if you were already covered as a retiree, you can apply to continue that insurance coverage under your name as what we call the head of contract. We do allow for you to do that. And if you have kids, they can continue on until that age. The only thing is that you can only carry over to your name what you had at the time that the retiree passed away. So say you only had medical, you can only apply to continue with medical. You cannot apply for vision or dental because you didn't have that at the time of their passing. And for active employees, I know this is more retirement, but the state gives your dependents free 6 months health insurance if you were to pass. So just know that that is something that we keep in there to make sure everyone's taken care of as well. And for the second one, so a retiree who is no longer eligible for group health insurance, they turn 65, they are not eligible to add a dependent to their insurance once they become Medicare eligible based on the age of 65. So if you have a child later in life, or if you gain legal custody of a child, if you're 65, you are not able, unfortunately, to put them on the insurance. But if you are under 65 and you're already on the group health insurance, you can still add them on. So please be aware of that. We've had instances of that, especially getting legal custody of grandchildren, so this does come up. And then for the third bullet point, basically what you elect now for the current retirees, August 26th, is going to go into effect January 1st. You will be locked into that plan, but we do allow for open enrollment for retirees, just like regular active employees, where if you want to make changes, you can still go ahead and make those changes. And or if you have a special qualifying event, if you need to make changes mid-year, we allow that as well, but technically what you pick is a plan that will start January 1st. All right, so we're going to go over the different types of plans. I know this is a lot of changes because you guys currently only have Cigna right now with the Local Plus and Open Access, and I'll kind of break down how this applies to Blue Cross. And a lot of ways it's similar, so it's not going to be a big change. It's just basically network decisions on what your doctor is going to be under, whether it's Blue Cross or Cigna. So we have 4 health plan options. There's 3 PPOs and 1 CDHP HSA. So the easiest way to explain the Premier PPO Standard and Limited, Premier PPO has the highest monthly premium, but you pay less on the back end as far as co-pays, yearly deductibles, maximum out-of-pockets, and it just kind of filters down from there where you're looking at standard or limited, where with standard it's a little bit cheaper monthly, but again it offsets itself with the deductibles higher, co-pays are higher. Now for the local CDHP, it is the cheapest premiums, but you are going to be paying out co-insurance, and the yearly deductible and max out-of-pocket's a little bit higher. I do want to point out for retirees, as an active employee, you can usually elect to put money in your health savings pre-tax, but as a retiree, it goes in post-tax. We don't have a way to set it up pre-tax with TCRS. However, if you're still on this plan, you can consult with your tax, whoever prepares your tax, because there's a way to claim tax benefits to try to get some of that money back. So we're not tax professionals. I would not tell you how to do it at all. I don't know. But just make sure that there is a way to recover that. So any questions as far as the plan breakdown? And we're good? Okay. So on the bottom in red, I want to point out as far as what you guys are currently on and how it may, what's similar to it. So if you're currently on the county deductible plan, it's going to be similar to the Premier PPO plan. If you were on the county copay plan, it's going to be similar to standard PPO. And of course, the county HSA plan is the same to our CDHP HSA plan. Now, all 4 plans, there's no charge for preventative care as long as you are in network. So if you have just annual checkups, that's all going to be covered. And then for the PPO plans, it's just co-pays for office visits, ER visits, and again, with HSA plan, it's co-insurance in place of the copay. Now, for deductibles, this is for the 2023 year, so you can see the breakdown as far as the different plans with the PPOs and the HSA, and you can see right away the Premier. As I mentioned earlier, it's a higher monthly premium, but the yearly deductibles are the cheapest. So that's kind of to give you an idea as far as how it breaks down as well. And then the out-of-pocket max, again, it's the same thing. Premier PPO is the cheapest. And then the state allows for certain eligible expenses for both medical and pharmacy costs to be combined towards your deductible and yearly out-of-pocket costs. Now, once you have those plans, you can now have to look at the network. So this is where it kind of gets confusing for a lot of people. You're aware we have the two carriers, which is Cigna, Blue Cross Blue Shield. Currently, you guys have the Cigna Open Access, which is what we call the broader network. So the similar plan to that is Blue Cross Blue Shield Network P as in Paul. And it's basically, you have a little bit more options, but they're negotiated at a higher rate. So that's why there is a higher premium for the broader network. There's some doctors that are in the broader network where they're not in the smaller network. And you have to be aware that because we call it the broader network, technically the state charges $65 more monthly for employee only or employee plus children. For employee plus spouse or family coverage, it's $130 more a month. Your agency has absorbed some of the costs, but it's still going to be a higher cost compared to the smaller networks. Now, for your current Cigna Local Plus, that's comparable to Blue Cross Blue Shield S for small. It's a smaller network. It's an easier way to look at it. You have a little bit smaller pool, but it's still so much providers, doctors, clinics that you can go to, and the rates are negotiated at a lower cost, which is why the monthly premiums are a little bit cheaper. What I do want to say is that most people can get away with joining the S plan. I had someone at another agency dead set on joining the broader network, was going to pay, his agency didn't cover the $130, so they were just going to pay $130 more a month. I looked up all of his primary care doctors and specialists. They were all in the smaller network. He did not have to pay that $130, so it's in your best interest to just do the research, check who your doctors are under, because, I mean, I want to save $130 a month. I don't know who wants to just throw it away. So just make sure to do the research. And a lot of people, even I myself, I live in Clarksville, it's a smaller town. I do the S just fine. There's no issues finding doctors. I don't, not this one. Okay, we'll show you the website of where you can pull this up as well. And so this is the hospital list for Rutherford County. So this will give you an idea as far as just hospitals that are in and out of network. Again, it's just doing the research to see where you're going and if it's what network to go under. So you can see right away St. Thomas is in network for both the smaller networks and the broader networks. So you can just pick the smaller one if that's your go-to. But if you look at Stonecrest, Centennial, Skyline, they're all the TriStar HCA, and fortunately, they're only in the broader networks. So if those are your hospitals or clinics, just providers you want to go to, you will have to pick their broader network. So that's this kind of a way to research this. Now, for the clinics, as far as little clinics, and the Minute Clinics or Vanderbilt Health, these are some of the options that are available for both Cigna and Blue Cross that you can go to. Before I get started on the voluntary products for dental and vision, any questions? Yes, ma'am.
Midpoint, Midpoint, I'm sorry, Midpoint. Are they out?
Yes, ma'am. They are as of the end of this year. Yes, ma'am.
We won't have Midpoint, so
No, sir. It's going away completely, correct? Yes. Yes, sir. Okay. So, oh, yes, ma'am.
In the previous slide, you listed like in-network, out-of-network, yes. What if you're out of state, traveling and out of state? How do you know what would be in or out?
It's going to depend on the carrier that you pick. And Amy, our Blue Cross vendor, I'm so sorry, how does that work when they're out of state? Because there's a special way that they look at it.
Yeah, that's fine. So you're looking in Tennessee for S or P. So those are for Tennessee providers and any contiguous. If you're traveling with Blue Cross out of state, you're going to have our large national network Blue Card. So you have a suitcase on your ID cards, you can just travel with these. Wherever you are, you just ask the doctors if they take their local.
And the same thing with Cigna, if you're ever out of the area and you have an emergency situation, then you seek care at the nearest emergency room. That will be considered in-network. If you do elect Cigna Local Plus, if you're in the state of Tennessee, the entire state of Tennessee is Local Plus. If you're out of Tennessee and you're in an area that doesn't offer Local Plus, you'll access Open Access Plus. And just a little information about the MedPoint clinics. Many of the doctors at the MedPoint clinics are St. Thomas, Ascension St. Thomas providers. So if those clinics go away, those doctors will probably disseminate out into the community through Ascension St. Thomas. So you'll want to check on those individual doctors.
Which St. Thomas is a network for everyone.
Thank you.
Okay, so for voluntary products, all right, so you do qualify for retiree vision. One big thing to note for current and future retirees, there's a rule with retiree vision that you must be enrolled on retiree medical insurance to qualify for retiree vision. If you're on it and when you turn 65, medical and vision both drops the first of your birth month when you turn 65. But to get it, it cannot be a standalone. You must be enrolled in retiree vision, medical insurance to get retiree vision. So please keep that in mind.
So what if you're not in the vision before retirement? Because you know it's extra.
Mm-hmm.
Can you get it at retirement even though you had medical
Yes.
but you didn't have dental or vision? Could you sign up for the dental and vision even though you didn't have it before?
Yes, that is
Okay.
correct. You can apply. They're just voluntary products where it's just the main rules is for the medical insurance. And of course, if you're already getting a TCRS pension check, that automatically qualifies you for vision as well. And IMED is going to be our vision provider as of January 1st, 2023. We do have our IMED rep right there, Dawn. If you have any questions, she can provide you more information. I actually just found this out yesterday, speaking with our Director of Vendor Services, that IMED does cover discounted rates for hearing tests and hearing aids. It threw me off a little bit because it's vision, but that is something that is available, so you can check with them if you need any hearing aids or hearing tests. But we basically offer two different plans, which is basic and expanded. It's slight cost differences where expanded is a little bit more expensive. You can see the charts here for in-network and out-of-network, and then the different offices that you can go to for your vision care needs, like independent network provider or Target Optical. You can see the differences between the two where there's co-pays for the eye dilation where it's $10 for basic but no cost for the expanded, and then the retinal imaging, it's $39 for basic, but there's no cost for the expanded. I do know that if you pick the expanded, it's going to give you more coverage for people who have glasses or contacts. I myself, I wear contacts. I always pick expanded because it's less money out of pocket when I do go to my yearly exams and order more contacts. And the cost differences vary. It's not a whole lot. So if that's something you do need, you may want to look into the expanded plan and see the difference of what it covers for glasses and contacts and exams. Now, with dental insurance does not have a requirement to be on medical like vision does. So you can, if you don't want medical or vision, but you just want dental, it can be a standalone. And one big thing that I love about dental is you can keep it past the age of 65, so you're not dropped. You can continue covering yourself and your spouse for dental. And we have two dental options, which is Cigna DHMO and Delta Dental PPO. Now, Cigna is a little bit smaller network. It has less providers, but the thing that I love is that they do not have a waiting period. So if you need a crown or just a root canal, you're able to get that right away, and it'll be covered. You must declare a primary dentist who you want to go to with Cigna, and so that is something to keep in mind. With Delta Dental, it's a bigger network. You're not required to declare who you want to go to. As long as they're a network, you're good. However, there is a waiting period. So regular cleanings, just fillings, x-rays, that's available right away. But if you need like a crown, that's a 6-month waiting period before Delta Dental will pay out. But it depends on what you need. Some waiting period is 6 months to a year, but this is only the first year. Once you clear the first year, you don't have to deal with the waiting period anymore. It's only because you guys are just starting. And again, because it's a larger network, it is going to be higher than the Cigna Dental. But just check, because if your doctor is in the, or your dentist is in the cheaper Cigna, go with Cigna. Now, I mentioned earlier as far as annual enrollments for retirees. So annual enrollment is going to be the month of October of every year. You guys will not see annual enrollment until next year, but just to give you an example, for 2022, the period is from October 1st until the 28th. So you have the whole month to kind of make decisions. We do let you know that annual enrollment is going to be coming up, where we'll send you a newsletter in October that tells you, hey, it's coming up, these are the changes, this is the cost for the upcoming year, and there's going to be an application for any changes on the back of that newsletter. And if you lose it, you can always call the service center, we'll get you another one out, and I'll show you a way to pull it up online as well. Now, if you are not enrolled in retiree insurance, you cannot just enroll yourself on retiree insurance during annual enrollment. You have to apply, kind of how I explained earlier, because we have to make sure that you qualify. So if you're not on it, you can't just put yourself on it at that time. So please be aware of that. And as with most insurances, whatever changes you elect during annual enrollment, they go into effect January 1st of the following year. And this is our website. So if you go to www.tn.gov/partners for health, so that's tn.gov/partners for health, there is a bunch of tabs along the top, and you'll see one that says annual enrollment. Right now it's not active, it's a little bit early, but it's still there. But if you hover your mouse, there's a section that says for retirement, and if you click on that, it'll have electronic versions of the application, the newsletter. It happens, it either gets lost in the mail or you misplace it, but you can always pull it up as well, and you can scan the QR code to go directly to the site as well. Yes, sir?
All the things that you showed earlier are on this site,
Yes, sir.
like eligibility and whatnot.
Yes, sir.
Which one of those tabs will it be?
That is, I'm about to get to that in our resources. So on the same website, you'll see there's a bunch of tiles on the right side, and you'll see where it says the retirement tile. And if you click on it, it'll bring you over to this page. And make sure you're selecting local education. There's going to be categories for state, higher ed, local government, and it'll have information for certified teachers, support staff, dental vision. And you're going to click where it says Guide to Continuing Insurance at Retirement. It's going to have a lot of the rules, eligibility guidelines of what I'm going over today. Now, I do want to put out a disclosure, is that the information on our website currently is for 2022. You guys are not starting until January 1st, 2023. So the information is going to change from what you're seeing online to what's going to happen January 1st. And so just be aware of that what I showed earlier is not going to show for the premiums if you click on it on the website. And any questions? Yes, ma'am.
Okay, so we're supposed to file by August 26th that our intent to change.
Yes, ma'am.
But then we're still due open enrollment? Or do we have to make those choices by August 26th, I mean?
Did we talk about how?
Because if it's not live for us to look at, and we've got to make.
Well, we have the information for 2023, but it's not posted online as of yet. But it's in your packets as far as the plan comparisons and the premiums. So, like the eligibility, or?
Well, and some of those other comparisons. This pack, remember that's why I said, did that in the packet? You said no.
Yes, but I can show you how to look at it online. But as of right now, we usually try to post it around for 2023. When does it normally go live? September 1st.
Okay, so by August 26th, so we don't do open enrollment, we just do the August 26th deadline?
Is that correct? The deadline we're giving them for August 26th, when the normal annual enrollment comes around for retirees for Rutherford County, they don't make any changes then. Is that correct? No. Sorry. Okay, we'll have to table that. You can give me your information afterwards, and I can get back, and then we'll try to have a way to get it out to everybody so they know what to do, because we did not.
Once we apply, it's a done deal. We don't have to go back in and enroll again in October. That's what you're asking, right?
Yes, ma'am, that is correct.
It sounds like we're not sure.
So Judy, from what I'm hearing, this form right here, everybody can see this is what they need to complete by August the 26th and turn back into me,
Yes, ma'am.
right? So this is where you're going to pick what plan you want, what network you want, all of that. So the premium packet that you're going to look at to determine that is in your packet. The benefits summary, even though this is not on their website yet, it is going to be in your packet to look at, the 2023 benefits card. So we can do this, one-on-one to get this done so that we can get you enrolled in the right one. But this is the form that has to be turned back into me by August 26th.
So in essence, yeah, because as of the annual enrollment time, you're already going to have it picked, so you really wouldn't do anything.
So then, come September 6th to October 31st, those days I gave you all of those, that's not going to affect any of the retirees. That will just affect those employees that are still actively working.
Yes, ma'am, because what they pick on that form is what's going to start January 1st. Yes, ma'am. Oh,
I just want to point out, open enrollment versus annual enrollment, right now.
We've got open next year, you'll have annual. I just want to clarify.
yes.
Just to be sure. Okay. But what you said.
And if something changes, we will let everyone know, because we really have not clarified just yet. So I just want to make sure that we're on the same page with everything with this. Okay, so on the first page of your packet, this is where it's what we call the roadmap. You can click on the QR codes. It's going to walk you through kind of what I went over today as far as researching your plans, going on our websites, and looking at providers. And I'll go through our website later on just so you guys can see how it works and where to look for providers to see what network they're under. And also, we didn't talk about pharmacy a whole lot, but the pharmacy QR code is going to be in the bottom left-hand corner of the form. Our provider for pharmacy is CVS, but you don't have to just go to CVS. Please know that there's other in-network like Kroger's. It's just the name of the pharmacy provider, but usually some people use local pharmacies or go to Kroger's, whatever's closest. I live in Clarksville. There's no CVS there, so I go to Kroger's. So just don't confuse the name thinking that's the only place you can go fill medicine at. So I just wanted to make sure everyone was aware of that. So when you turn 65, I mentioned that you will be removed off of the medical insurance plan and that you will have to go on Medicare. The state offers a traditional Medicare supplemental plan. Just to put it out there, I believe Rutherford County offers a Medicare Advantage plan that has prescription drug coverage. That is separate from the state, so to find more information and how it works, you'll have to contact most likely Suzette and team to get more information when you turn 65. But if you don't want the Advantage plan, you go on traditional Medicare. The state does offer the Tennessee plan, which is a supplemental plan for traditional Medicare. Now, this is not offered to the general public. It's not offered to anyone. You must have a TCRS pension based on your own service in order to qualify for this. And UMR is our claims administrator. You may have heard of it. The full name is the Tennessee Plan with UMR POMCO. Some people say POMCO, some people say the Tennessee Plan. It's one plan, and it's just various names of it. Now, the eligibility is going to be similar to our retiree plan, where you have to be enrolled in Medicare, you have to have employees just a start date prior to July 1st, 2015, and that you must be receiving a TCRS monthly pension. This only covers traditional Medicare Part A and B as in boy. It does not cover prescription medicine, so you'll still have to enroll in Medicare Part D. I just say D for drugs, it's easier to remember that way. Yes, ma'am.
Can't take this, right?
Well, technically, you have to be enrolled before you can add a spouse. So if your spouse is older, they'll have to find something else until you turn 65, and then you can add them on at that time. Yes, ma'am. And then because your county offers the Medicare Advantage plan as well, if you enroll in the Tennessee plan, and if you enroll in the Medicare Advantage plan, the Tennessee plan will not pay out anything. You're wasting your money. Please pick one or the other. Don't do both. We have people try to do both. And you have to pay a monthly fee for the Tennessee plan. Like certified teachers, 30 plus years, it's $90.55. But you're paying that, and it's not going to pay anything. Again, it's a waste of money. And we'll tell you if you ask us, like, please one or the other, but it will not pay anything. So just know that when the time comes, it's either the Medicare Advantage plan or traditional Medicare, and you pick the supplemental plan. Now, I mentioned earlier with the application, when you newly retire, the application to continue insurance at retirement, you have a 30-day time frame. However, for the Tennessee plan, you get 60 days to apply for guaranteed approval. There's no pre-existing condition stipulations. So when you first retire, like say you're 67 and you're about to retire, you have 60 days to apply for the Tennessee plan for guaranteed approval. If you're already retired, 5 years later you turn 65, your birthday is May 15th, you will have 60 days from May 1st to apply for guaranteed approval. If you miss the 60 days and you want to apply, or even you decide you don't like the Medicare Advantage plan, you want to go traditional Medicare and apply for the Tennessee plan, once you're outside of the 60-day time frame, you can apply, but you're considered a late applicant, and there's no guaranteed approval. There's a second page that's going to have a questionnaire. It's only asking 4 questions. It's if you've had a heart attack, cancer, stroke, or kidney failure within the last 5 years, it's yes or no. And we send it to the POMCO group, and they review it and let us know if they approve you or not. So please be aware of that you can still apply, but after 60 days, there's no guaranteed approval. And we did cover, oh, yes, ma'am. Yes, that is correct.
Okay, but under the Tennessee plan, not Cigna. I mean, under the state plan, not Cigna, right? Just Cigna.
Well, the Tennessee plan is for post-65, but you can cover spouses that are under 65 for the regular retiree insurance.
He's 65 in May. I won't be 65 for another 3 years.
Right, he'll come off the plan and he'll continue the retiree-only coverage.
You're saying I have to be on the post-65 plan before I can put him on it?
Yes, that is correct. Yes, ma'am.
So for 3 years, we'll have to, that's what I'm asking.
Yes,
He'll
so-
come off in May. Okay.
Yes, just to clarify her question, since there was a little bit of confusion. So she was asking if she was able to cover her spouse on the Tennessee plan when he turned 65. Since he's older than her by 3 years, when he turns 65 in May, he has to come off the retiree insurance. And if they decided they wanted the Tennessee plan, he has to wait for her to turn 65 before she can add him on the Tennessee plan, and he'll have to look for other outside supplemental coverage. So is everyone, any questions, or we're clear? Okay. All right, so with the premiums for the Tennessee plan, I mentioned it earlier as far as certified teachers. So just like the regular under 65 premium, certified teachers do get a premium reduction based on their years of service, but local education support staff do not get any premium reduction unless your agency has passed a Medigap resolution. Basically what that is the county passes a resolution saying that they're going to offer to recognize the years of service for support staff, and they're going to absorb the cost so you can get that reduced amount. Now, for the application for the Tennessee plan, it's another application that you have to be aware of. Again, right on top it says the name. 3 months before you turn 65, we'll send you a packet to kind of let you know, hey, you're going to be taken off of the retiree insurance. and that you do qualify for the Tennessee plan. It'll be a booklet along with the application. So if you do want to apply for it, you can just fill it out and send it back in. Now, one thing to note is that we've had people qualify for Medicare under the age of 65. So for various health reasons, say you're 55 and you're Medicare eligible, you can apply for the Tennessee plan and just fully go on Medicare. You don't have to wait until you turn 65. The only stipulations, again, is just working before July 1st, 2015, the pension, and so if you're under 65 and qualify for Medicare, you can apply earlier. But the state allows you another option. If you're Medicare eligible and under 65, if you want to keep both Medicare and the state retiree insurance, you can, but you have to enroll in Medicare Part A and B as in boy, which will be your primary insurance, and then the state retiree insurance will be secondary to that. So please keep that in mind as far as how it impacts. Oh, did it stop working? Okay. Hold on. All right, so any questions of the special Medicare? Yes, sir.
So the Tennessee plan covers what parts of Medicare?
Traditional Medicare Parts A and B as in boy. A is hospitalizations and B is clinical visits like a primary care doctor or specialist. Not the direct. We'll have to enroll in Medicare Part D separately. And we have another state agency that will help you find a plan. We love recommending them just because they're not commission-based. They're just there to help. So they'll put in your medication in the system and go over the different plans, and you pick which one you want to enroll into. Where they're not predatory, which is why we love referring people to them. All right. So I know this doesn't really impact a lot of people where you might turn 65 5 years or 3 years from now. So we do offer the Tennessee plan on our YouTube channel, and I'll show you the link again to pull up the video, the QR code where you can watch the video. It'll go over a lot of the information that I've covered today for the Tennessee plan because it's kind of hard to take it in when it's like 5 or 6, 7 years from now. And rules may change, so you want to make sure that when the time gets closer that you have the most up-to-date information as well. And I'm just pausing. I see people taking pictures. So. Yes, I can send it as a PDF to Suzette, and she can distribute it, so that way you have the information as well. Okay, so we want to make sure that everyone has a successful enrollment and onboarding process. So I'm going to go over 2 key things that we always run into that kind of puts a hiccup in the enrollment process. So those that are covering dependents, whether it's children or spouses, on the second page of the application, it's right behind the application in the packet, there's going to be a list of the types of dependents that are covered and the documents that we require for you to validate those dependents. For spouses, we do require 2 documents. Is anyone in here married less than a year? Okay, no one? Well, if anyone does get married in the future, if it's less than a year, we only require a marriage certificate. But if it's over a year, we need a secondary document on top of the marriage certificate. There's a specific list with time frames. So if it's like a first page of your tax, you can only do it within a year. If it's a mortgage statement, it's within 6 months. So please make sure you're following the specific list and time frame. We cannot accept utility bills. It has to be within that list. And we usually get a lot of utility bills, and then we have to pause, reach out to Suzette and team. They have to reach out to you, so it puts a delay, and we want to make sure this goes as smoothly as possible. And then children, as far as biological, adopted stepchildren, it's just birth certificates, court documents, and proof of marriage and such to validate those children as well. So we do cover a lot of different types of children for families. And the other thing I want to make sure is that please make sure that you are filling out the forms fully as far as information, signing and dating. Again, if you're not enrolling in dental or vision, leave it blank. But as far as everything else, please make sure it's filled. We've had to pause applications because the date of birth was missing. It's HIPAA, we don't know if it's you. So that's why we need everything filled in. And again, with the dependent documentations, please make sure it's there with the application. We have had instances where they never came back and gave us a document, so the dependents were not enrolled, and we just enrolled the retiree as just single, and their spouses were just left out, and they have to wait until annual enrollment to add them back in. So that is something that happens as well. And I mentioned earlier, as far as the BA Service Center, we have a retirement department. So this is the number that you can call and hit option 2. It gets you with awesome retirement analysts that has the ability to look into your record for insurance and TCRS, and they will be the ones to give you the confirmation as far as your premiums, your years of service. And what I was telling someone earlier, that once they confirm you're good to go, they can note it on your record, so it's less issues later on down the road, that it shows you called, they confirmed this is what you're working with. And if you don't feel like talking to them, there's the email address as well. The same analysts work the email tickets, and they'll be able to answer the same questions through email as you would over the phone. And as far as with this, I'm going to show the website real quick before I pass it over to our Blue Cross and Cigna vendors. You guys hear me okay? All right, so it's the website that I told everyone about earlier as far as the tn.gov/partners for health. As you can see here, it's the annual enrollment, and then there's retirement, and then there's that retirement tile that I mentioned earlier. So to research your providers, you can see on the left side there's a tab called Health Options, along with other benefits. So under Health Options, you can see where if you click on Health, it goes over information along with the websites for our vendors in detail, and it just kind of breaks it down. Make sure you are always selecting local education or local government, and again, it breaks down the different PPOs as well. And then if you are looking to search for providers, you're going to go to Health Options and then carrier information. And that is where you'll find all the hospital lists that I showed a snippet earlier, so you can see who's in or out. And then you can research the smaller network, bigger network for Blue Cross, and the same for Cigna. So that's where you would go to research your providers online. And then if you're looking at pharmacies, you just Health Options Pharmacy. And then for the videos, for the Tennessee plan, it's under the section of videos on the far right. So that's how you would kind of navigate the web page. But all the information that I'm providing today is all online. And just, again, it's for 2022. 2023 is not up yet. But with this, I will go ahead and, well, actually, before I do this, anyone have any questions? Yes, ma'am.
On the application that we have to turn in on the 26th, we can't do it on the computer, right? It has to be on paper?
Yes, ma'am, it has. We don't have a way to electronically input the retirement open enrollment just yet, but when you go into annual enrollment, there is a way for you to do it electronically, but it's just the initial open enrollment, we have to do it by paper. Yes, ma'am.
I'm still wanting to make sure I understand what Mrs. Kim was asking earlier about what was needed to be filled out August 26th.
Mm-hmm.
That's for current retirees?
Yes.
Okay, current retirees?
Yes.
Not upcoming retirees in 2023?
Yes, ma'am, that's correct.
I have 2 questions about spouses.
Okay.
Can, if I retire, decide not to take the insurance plan, go on my husband's insurance, can I come back to this insurance?
As long as you met the initial eligibility criteria prior to leaving, and then when you come back, that you're under 65, you can reapply as a special qualifying event that you've lost coverage, but you will have to provide proof of loss of coverage as far as, usually it's a letter and a company letterhead that verifies that you were under your spouse's coverage, what coverage, that he was retiring, and then the date you're losing coverage. So say you lost it August 31st of 23, we'll start at September 1st, so there's no lapse. But there is certain criteria that we will not allow you, like say you didn't pay the premium and you lost insurance because of not paying, we won't allow that. But as far as retirement, layoffs, you can apply to come back. Yes, ma'am.
Come back.
And I did advise someone earlier that if that's something that you're considering, because active insurance is cheaper than retirement, so why not? You can call the BA Service Center, and they can double check to make sure that you met all the initial requirements prior to retiring, and then they can note it on your account. So years later, when you're reapplying, it's already there showing that you've met the requirements prior to leaving.
The second spouse question is, if I retire, decide to go on this insurance, but my spouse is still employed and eligible for insurance through his employer, can I bring him onto this plan?
Yes, you can, as long as you're under 65.
Okay. Okay.
And any other questions before I turn it over to our Blue Cross? Yes, sir.
So if, like, my wife is older than me, so she is already 65, I'm not. So is she automatically just going to be dropped off?
Are you still actively working or you're retired?
Yeah, I just retired this year.
Oh, unfortunately, yes, sir, because once she turns 65, you will not be able to cover her on medical or vision. So when does she turn 65? You said this year? Or? Yeah, so when you apply, you can apply for yourself and only dental for her, but she even if you put marked like retired plus spouse for medical and vision, when the BA Service Center Retirement Department gets that, they're going to send you a letter notifying you that only you can be added on for medical and vision, and she will not qualify for medical and vision, but you can keep her on dental.
That's different from what we have here at the county, right?
I'm not sure what you have with the county.
I mean, because my wife is still kind of on my insurance with drugs and everything, so, but, so she'll just have to but then when I turn 65, then I can pull her into Tennessee.
Yes, sir, that is correct. And then, again, talk to the reps with your options with the county advantage plan as well, as far as if you can cover her there as well. Because it covers drug costs, sometimes it's a little bit better than the traditional Medicare and cheaper.
And Rutherford County did say if there are situations where individuals didn't meet criteria, to give the risk management office a call, because I don't know the answer to that question, but I will call them and ask them, because they may be able to do something different.
I also understand that a few of us that fell into a thing like that might get something else.
Yes, sir. Okay. Yeah, that's the thing. We only have information for the state side with rules, but what's happening with the county, we really don't have information on that. So you'll have to check with your reps. But, okay. Oh, yes, ma'am.
If you're an active employee, you're already over the age of 65, and so is your spouse.
Active employees, you can keep active insurance past the age of 65.
And then I'm going to retire, next year. That doesn't affect me or my spouse?
Not at all. The only thing is that when you retire, because you work past the age of 65, you'll have to show proof that you had active employee coverage to avoid the penalties. Yeah. But yeah, you're good. I've seen teachers teach until 70, and they were just fine. I mean, keep it as long as you can. It's good insurance. So.
I'm retired. I give it to you, bring it to you here.
Email it to me,
I can mail
or
it
you
to
can
you.
come up here.
Is there, this address is?
No, I'll have to give it to you, and that was one thing I wanted to add. So if you are currently already retired, and you can meet one of these three afterwards, make sure we have your email address and phone number, so that I can reach out to you and say, I don't have your form yet, and I don't have any business cards yet, but I will email everybody the correct address to mail it to you.
Because my friend got this in.
Okay, so chances are I don't have your email address, so because I got that list from the county, so I want to make sure I give everybody's email address if you're retired.
And we're also going to be open for questions afterwards, and you can verify with our vendors as well. Again, we want to make sure everyone's questions are answered. But, okay, I will pass it over to Amy Jordan. She's our Blue Cross Blue Shield rep, and she's going to go over more information as far as what Blue Cross covers, since it's going to be new for a lot of people. Thank you, guys.
Good afternoon. Everybody awake? Everybody need to stand up and stretch or anything? That was a lot, wasn't it? Yeah, that was a lot. You retired educators. You remember how the kids felt, right? I can speak because my mom and dad are both retired school teachers. So Blue Cross and Blue Shield of Tennessee is very excited to be one of your medical options for 2023. And we'll go very quickly because your choices, you've been inundated with information today. Let's just be honest. So just to give you a background of who we are, we're Blue Cross and Blue Shield of Tennessee, a not-for-profit here in Tennessee. We're committed to the communities across the state. We're fellow Tennesseans. We're based out of Chattanooga. And has everybody heard of Blue Cross? No, I'm not going to ask who has Blue Cross yet, so we won't go there, but you're taken care of with our friends at Cigna today. But we're more than just the health insurance company. We're actually out there in the communities. We actually, in Chattanooga this week, we kicked off our first college. So we have about 27 new students that started on our big, we call it Campus on the Hill, because most of us, since the pandemic, we work from home now. So we have that big campus. So we have future IT engineers going through a 27-week, it'll be a bachelor's degree that we've partnered with our friends at ETSU up in Johnson City. So hopefully we'll get some smart IT folks to come to work for us after, but another way that Blue Cross is just giving back to the communities. So in Tennessee, your choice, if you come with Blue Cross, is going to be S for the narrow, P for the big, in Tennessee. Again, like I said earlier, you get with the medical card, with Blue Cross, you get a suitcase on it. Very easy once you leave the boundaries of Tennessee to stay in network, in our national network with the Blue Card. The only thing to keep in mind is if you are looking outside of Tennessee on our search tool, be sure that on the networks you have a selection for a drop-down box. And you're going to put in like Dallas, Texas, or if you have children on your plan that are outside the state of Tennessee in college, you're going to put whatever city and state they're in, and then you're going on the networks, you're going to look for Blue Card, PPO, and to make it easy, we've got parentheses outside Tennessee. So you should know where you are when you're looking, and that'll give you the large national network, the Blue Card. So again, very easy to travel with Blue Cross. So we suggest when you're looking, so the plans between Blue Cross and Cigna that the state have designed are identical between Blue Cross and our friends at Cigna. So you can get any of the PPOs that are available or the high deductible, and those are going to be the same deductibles, the same out-of-pocket amounts, the same copays, and the same, I know we don't administer the pharmacy, but it's the same benefit structure because they're designed by our friends at the state, Benefits Administration. Now, where the networks come in is look at Network S first for Blue Cross if you're thinking of Blue Cross. Look up all your doctors and networks. I mean, it is the less expensive option for you through the premiums. If that works for you outside of any emergencies, now this is for providers that you would go to if you had a sinus infection, your primary care, your specialist, if you have a cardiologist, if you or someone on your plan have an orthopedic that you go to regularly. That's where you're going to look for those. If it's in an emergency situation, you're going to go to the nearest facility, okay? And we're going to process it. Us or Cigna will process it as in-network as long as it's a medical emergency. So keep that in mind. This is for elective surgeries and non-emergent situations. Here locally, I believe, Sharon with Cigna is I think you folks probably know her, but she's going to speak of the networks as well, and just know that our narrow networks are very similar here. When we get out to West Tennessee, there could be a difference. If you have any loved ones on the plan that live in West Tennessee, you'd have to look at a little difference. And I think up in East Tennessee, we may be just a little different. But here in Middle Tennessee, we have St. Thomas facilities in our network, our smaller network. We have Vanderbilt if you need to go into Davison. We have, the medical, Murfreesboro Medical. Now, when I talk about the big groups like Murfreesboro Medical, yes, we can say that we contract with a group of doctors, but be sure you check those individual doctors, just like the clinic that you mentioned earlier. Odds are those doctors that are in your clinic today, they are in St. Thomas with Blue Cross or Cigna both. So check the individual names before you make your decision. Do your homework. Y'all are educators, past educators. You know to do your homework first. If you don't see the facilities of choice, the HCA TriStars are not in our narrow network. You would need to buy up if you needed the surgery centers and things like that. So check the facilities there for anything non-emergent. So care, we've already touched on outside of Tennessee, nationwide, you have the Blue Card PPO, but you also have the opportunity to have in-network if you travel outside the country with Blue Cross through our Blue Cross Global Core program. Won't bore you with staying in-network versus out-of-network. The state's designed out-of-network benefits for you, but trust me, nobody wants to have those high out-of-pocket expenses for out-of-network. Be sure if you're in a normal, non-emergent situation that you stay in-network. So benefits and beyond with Blue Cross. You're going to get high-quality providers and hospitals, so we're right here with you to help guide you through your care decisions. You're also going to have access to our Blue Distinction Specialty Care Network that is nationwide. So that's for services for cancer treatments. I mentioned the cardiologist, any heart. That's just a very specialized, unique, through the Blue Cross Association, and that is nationwide. That's not just in Tennessee that you have an opportunity to utilize. News about the ER, be sure, and this is for today. This is a law that was passed. It's No Surprise Billing Act that went in January 1st, 2022. It's made our insurance and our providers, it's given us a little bit of a headache, but it's good for the consumer. It is. If you go to the ER and you happen to get a bill and you thought it was an emergency, call the insurance company and be sure that you actually owe that, because there are some laws in place now that the providers cannot bill you if it was for an emergency situation, whether you went in or out of network. So some extras with Blue Cross. We have telehealth through currently, in 2023, you folks will be coming on. We're making some enhancements. Currently today, the folks on Blue Cross have virtual care telehealth through our partner with MD Live. The enhancement is Cigna bought MD Live. So we're moving to another vendor, Teladoc. They just keep buying stuff up. I don't know about Cigna, but it's okay. They're our friends. But anyway, you have virtual care 24/7, 365 days a year, and the state has that plan, the benefit in place today. So for a very low copay, or if you're on the high deductible, it's lower than going to the doctor's office. You can talk to a doctor for the minor illnesses. So instead of getting out of the house, I know that my family's used it for sinus infections, strep throat. They've been able to call in the medicine, and we never had to leave the house. So in this world of COVID, it would be a great option not to have to get out. And you've got the home kits to test for COVID these days. So that's excellent. And then also outside of that benefit, Blue Cross providers at the beginning of the pandemic in 2020, we wrote out, if the provider has the capability to do virtual, you can actually do the virtual through our in-network providers as well. It'll be just the same benefits as if you went out to the office visit. It'll be those benefits as well. So you have two options for virtual health with Blue Cross. We have additional member discounts available to you. Through our Blue 365, we have gyms and fitness centers that are nationwide, over 10,000 of those in the network. And you also can enroll in free identity protection if you have Blue Cross Medical. So I have some flyers. These are just call out on some special programs that the state put in play. Diabetes prevention program is available for those if you haven't ever been diagnosed with diabetes. You can enroll possibly in the diabetes prevention. You get a scale, you get a coach, you get taught how to eat properly. I enrolled in that program. I am a pre-diabetic, and it absolutely is phenomenal. We have virtual physical therapy or exercise therapy available beginning this year, so that will be there through our partners with Hinge Health. And we also have a second medical opinion for you and your loved ones that is through Consumer Medical. So benefits on your time, you can go online at we have a dedicated member website. My brochure over here on page 3 has our direct contact information at Blue Cross dedicated call center and a dedicated website that has all of this information that's on my table and that I've talked about today. You can find that on there today if you wanted to go there and visit. But I do encourage you folks, you can go to the Partners for Health and get more information than you could ever want to know. But you can launch to the Partners for Health at the bottom of our website as well. So we're right here for you. I do encourage you, if you select Blue Cross, welcome. We will be more than happy to help you through your any insurance needs. But if you're happy with Cigna, I mean, again, it's the same plans. You're just looking for who you want to pay those claims back to the state because we pay for them up front. So you're going to have state insurance. You're just going to see if you want to carry a Blue Cross card or a Cigna card because you're going to be taken care of either way. So I'll hush. Any questions for Blue Cross? Yes, sir.
So when you're talking about the narrow plan or the smaller plan versus the other, when you go out of state, does that have any, so it's really only in-state that matters?
That's correct. You're looking for the narrow or the broad, your decision for your Tennessee providers. Once you go out of state, because Blue Cross is in all 50 states, so I won't bore you with how we make the claims work behind the scenes. But yeah, and in fact, if you're confused and you need services or you've moved to Florida for 6 months out of the year being retired, you can find a provider, call their office and say, do you accept your local Blue Cross? Because it's going to be the largest network in that state that Blue Cross has to offer. Yes, ma'am.
Did I understand you right to say that both Blue Cross and Cigna, their narrow plan and their broad plans, both their narrow plans have the same, or do we need to look at both the narrow plans to see if they have the exact same doctors? Like, could Cigna's narrow plan have a different doctor that Blue Cross Blue Shield's narrow plan has or may not have?
Yeah, when we compare, we're really talking about the facilities, because that's pretty easy. So here locally, the facilities are in the same. For the physicians themselves, I know Blue Cross, we credential and contract with them on an individual basis, even if it's a group. So we always say do your homework every annual enrollment. I'm sure Cigna will go over that, but I'm guessing they're the same. Yes, whether you choose Blue Cross or Cigna, you're getting pharmacy benefit, and it's designed by the state as well, but the vendor that processes the claims behind the scenes are Caremark CVS. And your behavioral health will be the same. It's with Optum. So you're just choosing network but you're going to get baked in wellness and behavioral health, and that's identical between Cigna and Blue Cross.
26, this would be for you and the Cigna ladies. Do you anticipate losing doctors that are listed now, since we're not going to see a 23 list of doctors? Does that?
Our disclaimer is, as of today, I know of no huge change in the facilities again. It is so large of a network, either the narrow or the broad, there's no way to stand up here and say, we're not going to lose anybody. Even in a group, a big group of doctors, the group may, in essence, be participating in both of our networks, S&P, but if that one doctor's office in there didn't get the credentialing paperwork in, didn't sign the contract for the next year, because doctors are coming and going out of the network. But a huge disruption, I can stand up here today and tell you I've not been privy to anything, but that doesn't mean I'm not going to go back to Chattanooga Monday and something happens. So again, that's why do your homework at the best that you can.
Yeah, same thing with Cigna. I mean, typically if there's going to be a huge facility change or a huge provider group change, they would let Amy and I know, and we would let the state know. We're not aware of anything that's going on right now. Those onesie-twosie doctors, they could drop in and out, and we not be aware of it, but we're not aware of any significant changes.
No, it's in the state contract with both of us, that if it's a provider group of 20 or more or a facility, that we have to let them know the instant that we understand that we're in negotiations with them. So like HCA TriStars are not in our small network, but that doesn't mean the physicians are not in the network. But if that physician only wants to send you to an HCA or a TriStar or a Summit for any outpatient surgery or an inpatient stay, then the facility would be out of network unless it was emergency. And I mean, I know it stinks. I wish I could stand up here and say, nope, never going to change. You know, we got everybody in. I argue with our provider folks all the time, but that's the nature of the beast. And I'm on Network S, so I take that chance too. Any more questions for me? I'll be here till the end. So I will now turn it over to my friend Judy, or my friend here. My friend Sharon with Cigna, and yes, we're competitors. Don't tell our bosses that we're friends.
And we've been friends for a very long time, so. Okay, good afternoon, everyone. So I am going to round up things and talk about Cigna for a little bit. So today we're going to spend time talking about the networks. We're going to go over resources, which you all should be very familiar with, having Cigna today. We're going to talk about virtual health. So a lot of the same things that Amy went over, we're going to talk about what it looks like in the Cigna world. So just like Amy talked about, you have two networks to choose from with Cigna. You have Local Plus, which is Cigna's narrow network, and you have Open Access Plus. So Local Plus is the smaller network of providers, but just like Judy and Amy talked about, I would start there. I would check and make sure to see if your providers are in Local Plus. And if they are, then there's no reason for you to pay that additional money to buy up to Open Access Plus. So if you have Local Plus today, and all of your providers are in there, and you decide that you're going to elect Cigna under the state of Tennessee plan, then you should not have any issues to continue that with the state of Tennessee, same exact network. How Local Plus works if you're ever out of the state of Tennessee is if you are ever traveling or on vacation or whatever it may be, if you are ever out of the state of Tennessee and you are in an area that Local Plus is not offered, then you automatically have access to Cigna's National Open Access Plus network. So you're never not going to be able to have access to an in-network provider network. Okay? So moving on to Open Access Plus. Open Access Plus is Cigna's largest national network. Again, if all of your providers are in Local Plus, then I would probably not even look at Open Access Plus, because the only time you would have to access that is if you were out of a Local Plus service area. Just like Amy indicated and Judy indicated, HCA TriStar is not in Local Plus, so if you are aligned with an HCA TriStar facility or network providers, then you may want to look at Open Access Plus, because they are in Open Access Plus. Okay. Here in Murfreesboro, Rutherford County, I know Murfreesboro Medical Group is pretty popular, and they were recently added to the Cigna's Local Plus network. They've probably been going on a year now, so if you access your care through Murfreesboro Medical Clinic, you shouldn't have any issues with Local Plus. Okay, so how many of you in the room are registered with MyCigna? Great, awesome. MyCigna is a great resource and tool that's going to give you access to lots of information. It's going to give you access to your benefits. It's going to give you access to your ID cards. It's going to give you access to be able to search for providers. It's intuitive, so it knows what network you're tied to. So if you've elected Local Plus, you're here in Tennessee, you're searching for providers in Tennessee, it's going to automatically pull up Local Plus providers. If you are in Local Plus and you're out of an area, let's say, just for ease, you're in Kentucky. Kentucky is not a Local Plus state or network area for Cigna. If you were searching for providers in Kentucky, then it would automatically revert and do the search for Open Access Plus providers. So again, you definitely want to register for MyCigna. The good news is if you've already registered and you continue with Cigna under the state plan, then all of your Rutherford County information will be available, through the end of the year, up to 18 months after, and then you'll be able to access your state of Tennessee information starting January 1st of 23. Okay, so along with MyCigna, we also have a mobile app. So how many of you have the mobile app on your phone? Great. So for those of you who don't have the mobile app, I would highly recommend that you download it, because everything you can do on your computer, you can do on the mobile app. And again, search for providers, see your claims, check out your benefits, see where you're at with your deductible and out-of-pocket, pull up your ID cards. All of that you can do on the mobile app as well. Okay. Cigna also has a 24-hour health information line set up for you, so if there's ever a need for you to access a nurse or have clinical questions, day or night, you can give us a call and you can access a nurse and ask them any questions that you have. We also have a discount program in place called Healthy Rewards. It offers a variety of discounts on things like gym memberships, food services, vitamins, alternative medicine, lots of different things, dental services, teeth whitening, so maybe things that aren't typically covered under your medical, dental, or vision, LASIK vision correction surgery. All of those things Cigna offers discounts for under the Healthy Rewards program. And you can access that again through your mobile app on My Cigna, or you can give the 800 number a call and they can answer those questions. So today you have an 800 number with Cigna. If you elect Cigna through the state plan, you'll get a new ID card, and the state has a dedicated 800 number aligned with Cigna, and they can assist you with that. Available 24/7, 365. So like Amy said, we all got used to virtual care during the last few years, more so than probably any of us thought would be ever possible. So that continues. Cigna partners, actually we own MD Live, so our virtual care vendor. So if you ever have a need and you have something like Amy said, a sinus infection or a sore throat or some sort of minor illness or condition, you can set up a virtual visit. Tell you, my husband uses it every spring and every fall because he's a farmer, and he gets a sinus infection every spring and every fall. And I typically call and set him up a virtual appointment. The doctor calls, they go through his symptoms, and the doctor will call him in a prescription, an antibiotic for that, and that takes care of his situation. So definitely take advantage of that. Some things that Cigna has added recently as of the beginning of this year, you now have access to routine care. So if you have a chronic condition that you're receiving medications for, like diabetes or hypertension, you probably have a relationship with the primary care, and I don't want to discourage that because we definitely want everyone to establish themselves. But if you don't, then you can access care for those type of services through MD Live virtually. Also preventive care. If you need to go have your preventive care, and you're probably saying, how can I get preventive care virtually? What they do is they do a lab referral to LabCorp, and you go and have your lab work. They send the results to the MD Live Cigna physician, and that physician will have a consultation with you virtually to go over that, so you can have your preventive annual visit. And then last but not least, we've recently added dermatology. So again, you're like, how can they treat, a dermatology issue virtually? What they typically do is have you take a picture of the situation, if it's a rash or something of that nature, and then they'll have the consult with you virtually. Okay. So a lot of the programs that Amy talked about that are extras, Cigna also offers through the state of Tennessee plan. We have a diabetes prevention program. So if you have not been diagnosed with diabetes and you have risk factors, or you've been told you're at risk or have pre-diabetes, we also have a pre-diabetes prevention program. What you would do is you would fill out a questionnaire and be accepted into the program if you meet criteria, and then they send you a kit to your home, which includes a scale. You have access to a coach and the whole program. So again, an awesome program. We have another account, and the benefits, a benefits person there joined the program, and I hadn't seen this person since last year, and I saw them probably a couple weeks ago, and they look like a different person. And I asked them, I'm like, what have you been doing? And they're like, oh, well, we've been doing the OMADA program with Cigna. And in less than a year, he's lost like 70 pounds. So if you have any type of bone or joint issues, maybe you're looking at a hip replacement or a knee replacement or some sort of back surgery, spinal fusion, that sort of thing. For the state of Tennessee, Cigna has set up a bone and joint program. And so if you're looking at any of those services, you definitely want to check out this program. And again, The services are listed there. Basically what you do is you contact Cigna, let them know which service you're interested in. They'll talk to you about the bone and joint specific network of providers. If you utilize one of those providers and you have a surgery related to one of these conditions, then as long as you're not on the HSA plan, then that surgery is going to be covered at 100%. If you are on the high deductible HSA plan, then that surgery would be covered at 100% after your deductible. The other nice thing about this, if you have to travel for more than 60 miles in order to have one of these surgeries with the bone and joint provider in the Cigna network, there's a travel benefit. So there would be a benefit offered to take care of hotel stays and maybe rental car purchases and things like that. Maybe you have the surgery and they tell you that you need to have exercise therapy or physical therapy. We also offer virtual exercise therapy through Recovery One. So if you have the need for that, you can get established with an exercise therapist, or we've actually contracted here in the state of Tennessee with physical therapists, so you can do that through the Recovery One program as well. And similar to what Amy talked about with Blue Cross Blue Shield, we also have a second medical opinion service through Consumer Medical. So if you are diagnosed or have been recently diagnosed with some sort of chronic or significant or unusual condition and you want to seek a second medical opinion, you can do that through Consumer Medical. Cindy and I had a coworker, and her 12-year-old son, was recently diagnosed with Lyme's disease, and she went through Consumer Medical to get a second medical opinion, and she said she got awesome service and awesome care related to that diagnosis. And again, there's a dedicated 800 number that's set up for the state of Tennessee, so you'll always be able to speak to a customer service day or night, weekends, holidays, whatever. Whenever you need us, we'll be there and pick up the phone, and you can actually speak to a live person. And similar to what Judy and Amy talked about, we have a website set up for the state of Tennessee. So, and all of that information is in the packet of materials that you received. So you can visit our website, or you can go out to the partner site and click on the carrier that you're interested in, and there's links that will take you out to the dedicated microsite. All of this information is out there. Again, you can give us a call and ask questions. And then if you do choose Cigna, you will get a welcome packet in the mail with all of this information as well. So I appreciate your time today. And again, we're here if you have any questions. Oh, okay. Oh, well, if you want me to.
I think you've got a question, Sharon.
Okay, sure.
To give proof of spouse or dependent, or will that just roll over?
So today you have Cigna with Rutherford County. The requirements for eligibility and validation of your dependents is through the state. So I'm assuming the answer is yes, right? Okay, all right. Yes.
Right, no matter what, or
The Board of Ed.
the Board of Ed, okay, the Board of Ed's going to the state. And so whether we pick Cigna or Blue Cross Blue Shield, it'll still be the state.
Correct.
So we could just stay with Cigna and still be counted as being with the state for that. You need to be, I think, 3 years to be in retirement, right?
Right, to meet the eligibility requirements.
Once 3 years pass, so you could pick either one and you still with the state.
Right.
But there'll be a different cost for each one, right? They're not going to
It
cost
looks the same.
Now, the cost is the same. The difference comes with the network. So both Cigna and Blue Cross offer the narrow, smaller network that has the lower premium, or if you need to buy up to the larger networks, that's where the difference in cost comes from. Okay. What other questions? Okay, I will say, just want to say that if, for whatever reason, after you've heard the state of Tennessee present, if there's a situation where you feel like you're questioning if you're going to meet criteria to be under the state plan as a retiree, then you can call the risk management department with Rutherford County, and they can answer any questions to see if you would still be eligible for what they will continue to offer retirees.
So just one other thing, I think your answer a while ago about your question a while ago about the dependent eligibility and stuff, Judy, and make sure I'm right, telling them right, everybody has to submit that dependent eligibility for the first time this year. Even though you've already done it for the county, we do require that you're going to have to do it again for the state because the state does need it, okay? So we do ask that we're going to have to get that from everyone. Those that need to mail their enrollment selection sheet back to me, the retirees, anyone that's retired right now, I'm going to give you the address, but it's also out there on the website if you don't have something to write with. It's 2240 South Park Drive, and it's Murfreesboro, 37128, and you can put it to my attention, and that's Suzette. It's Suzette, Couples, Cupples. I know, I think in the directory, y'all may see me as Eva, so I have an alias, so y'all, so just so you know who I am. So I think that concludes our today's meeting. Make sure before you leave to either meet me or one of my 3 staff members back there so that we can get all of your email addresses. And we're going to go ahead and ask you to give us your home address and phone number as well, because I want to compile a list to make sure I have it for everybody, the retirees. If you're an active employee, you do not need to do this right now unless you do retire. Then we would ask when you retire to do that, okay? It's Cupples, okay? Thank you all, and thank y'all for coming.